All right. Hey guys, I'm just making sure that we're on Facebook. That's good. And we're also on Instagram. Perfect. All right. Awesome. So, hey guys, welcome to the CPD Junkie podcast. #lockdown special, where every night at 8 p.m. we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Lawrence Stone, and tonight we are joined by Dr. Agnes Lai. Dr. Agnes Lai obtained her BDS from USYD in 2002 after practicing as a general dentist in Singapore and metropolitan Sydney. Agnes completed her Declined Dent in Prosthodontics at USYD in 2009 and was admitted as a member in the RACDS in the same year. She also is involved in, or had been involved in, the hyperdontia research in Westmead Centre for Oral Health, and has published her research in human neural adaptation related to an increase in occlusal vertical dimension using fMRI. She is also a contributor to the textbook Oral Rehabilitation, a case-based approach. Currently, Agnes practices prosthodontics in the private practice in Sydney Prosthodontic Group, Chatswood, as well as a clinical specialist at Westmead Oral Restorative Science Department in the public sector. He is a past lecturer of oral rehabilitation at USYD, where she was involved in both undergrad and postgraduate teaching of prosthodontics and dental implants. She currently maintains an ongoing clinical educator role to the current DMD in prosthodontics. She is also involved she is also serving as the federal executive of the Australian Prosthodontic Society in the past, and is currently serving as the state rep for the Australian and New Zealand Academy of Prosthodontics. Her extensive experience in general and specialist practice locally and overseas, and her friendly approach to patient care provide the patients with the highest quality specialist prosthodontic treatment in a warm and caring manner. She enjoys teamwork with her patients to rejuvenate, restore, and create people's smiles that is unique and tailored, with a comprehensive approach including mindfulness on etiology and recommendations on preventative strategies and risk mitigations. All right. Dr. Agnes Lai, welcome to the show. Hi, Dr. Agnes Lai, welcome to the show.
Hello, everyone. Hi, Lawrence. Thanks for having me.
So you've mentioned you've won the GS Card Scholarship in Prosthodontic Dentistry and the Faculty Research Prize during your undergraduate degree. Would you say you were destined for prosthodontics back then already, or would you say that, it took some years before you kind of decided you wanted to specialize?
No, I think it definitely took some years. Back then, like many dental students, I would say, I haven't really found my feet into what I really love doing. I would say actually I enjoyed oral surgery at that time. I also enjoyed, I get good marks at tooth cons and all that, but I definitely wasn't the student with the most number of crown preps or whatever to graduate with. However, I believe the reason why I probably won that prize in third year would have been a written paper in occlusion. So maybe I had something with occlusion back then. But no, I had no idea I would become a prosthodontist one day. That came several years after. Yeah.
So you briefly worked as a general dentist in Singapore. Tell us a little bit about that time and that process and what ultimately led you coming back to Sydney to specialize.
Okay, so I've pretty much always been a Sydney girl. So I grew up here since basically primary school onwards, and very protected home setting. So, I basically took every opportunity that I could since uni to feel a little bit more independent, if that's so to say. So it was a fantastic experience. So I went through the BDS program at the time straight from high school. So that was a 5-year program. And in third year, we could do a international exchange. So I took upon that opportunity and did an international exchange, and that was to Singapore. And so at that time, I made some friends and some connections there. So I guess maintaining that connection when I graduated from university, of course, they were like, oh, what about the prospect of coming here to work in Singapore? And so the door were semi-opened. Like I already had colleagues graduating the same year from, National University of Singapore, and they knew all the avenues to look for work. And as you know, Singapore is very open to expats. So at the time, I could just get an employment pass, and my degree from Australia was mutually recognized over there. So there wasn't any other external examination required. It was quite an easy process. Yeah, so I guess when I embarked on that journey, starting my first year dental career after dental school, had always been a temporary one. It was more an experience and a time where I could also be a bit more intrepid to travel different places because Singapore is such a centralized destination, not like all down south in Australia. So I spent a year there. Yeah, so it was good in that that learning curve was very much there. I got to work in quite a big practice where there were people who could mentor me with oral surgery. There were also prosthodontists that was there. There were different opportunities. So like here, how you can organize a charity trip to fill in a gap or to India. So in Singapore, there were opportunity to help people in need in Bali. Dr. Mara Elliott was running trips every 6 months to help the cleft lip and palate. It was quite structured. So, definitely learning opportunities were there. And then, but it was very hardworking. So I had to work certain nights and weekends, and it wasn't as free to travel as I thought it would have been. So at the end of the 1 year, I just took a few months break to do all the travel that I wanted to, and then come back to Australia. Yeah, where my home is. Yeah.
Fair enough. Fair enough. I'm sure the weather here is better. Hey.
Oh, I actually got quite used to that mugginess and the heat in Singapore. The heat actually never really bothered me. So I definitely enjoy the sun. I'm not the type to carry my the umbrella. And I remember how on first arrival, all the Singaporeans thought it was really strange that I would want to go for a hike, in Bukit Timah and and other places. And but yeah, I wanted to get a tan once upon a time. I got to be more careful now that I'm older. But yeah, so yeah.
Fair enough. So tell us a little about that, your CPD journey up to that point, when you came back to Sydney and you were working as a general dentist.
Mm-hmm. So I actually feel my early career journey was very limited in retrospect, knowing what I do know now. Having said that, I went to some local study group. I had some Invisalign training because the practice I worked in was an Invisalign provider, and I had a limited field of that mentorship. I went to a more industry profile driven type of courses. So, those anterior posterior composite courses that are run by actual company or suppliers. I went to those. And in particular though, I really enjoyed, and I was a member for the American Academy of Cosmetic Dentistry. And you begin to get to see the type of caliber of work that people deliver. And then I suppose, and then back in Sydney, where I was then doing things in my own comfort zone, and I was in a practice where there was a lot of TMD cases, because my principal at the time was quite strong in managing TMD patients. So in a typical practice, you may think, oh, the stats is like 10% TMD patients. So in one of the practice that I was working in, I would say it constitute about 80% of the patients. And she would stabilize them and then do a pros rehab. I was probably the associate that was dealing with the other 20% while she focused on those cases. But nonetheless, she gave me the mentorship where I could be more comfortable to rehab, say, quite moderate to severe wear, where I have to open OVD and deal with the rehabilitation in those. And after several cases of doing those bigger rehab, I feel that, short span, single unit, when it's not related to a major rehab type of indirect cases, I would attempt. But it doesn't matter how many case study you see in amazing journals. I was not able to feel like I could practice within that comfort zone to convert them. And I remember, even though I would stabilize the new jaw position and have the patient quite comfortable in the composite build-up, that is the point where I would refer to my favorite prosthodontist at the time, that was Markin. And he'd write me back some beautiful letters acknowledging what lovely work I had done and how he continued to look after my patient. And I suppose that was the point where I was discovering, oh, maybe I really like doing pros, because there was that process in really returning a smile. There was that process of restoring dentition to give back a smile and the functionality that they have. And I just felt very uncomfortable about doing it direct versus indirect, and and as you do more, you begin to know more your limitations as well. And so those were the beginning marks of where I felt I wanted to learn more in pros. Wasn't because I want to be a specialist. Yeah.
Yeah, well, that's interesting. I guess for a lot of us new grads, I guess we didn't realize, or I mean, I was just saying it to another guest as well, that the CPD that we're faced, where we get a pick from now, is a lot more diverse compared to what you guys probably had, which was, like you said, more industry based, wasn't it?
So it was interesting, because when I had the conversation, I remember the person who I am very grateful to, who probably curated me to become a prosthodontist. I owe a lot to Professor Ivan Kleinberg. He was the dean at the school and very much the head of pros, even in my undergraduate years. And I have crossed paths with him in different conference meetings, whether it was in Singapore, so he was an international speaker, or whether it's back in Sydney. And, from my perspective, entering pros gave me an opportunity to learn more about, your fixed and removable pros. But and I would share that, of course, from a theory base, I had demonstrated a strong inkling to occlusion, even since I was undergrad. And I have a very good understanding and foundation in regarding pain theory and the theory in management. But, when I think he particularly wanted me to do his PROS program was because of my exposure being where I worked, and the different, as in particular to occlusion and TMD, there are quite a number of dividing schools and theories, and at that time, because of the setting of where I worked, I went on a 60-hour residency learning about sleep and TMD. And, I feel even now, I would say I can see where a lot of the confusions are perhaps in many dentists who would ask certain questions, because sometimes the thoughts can be quite dividing depending on who you listen to. But my take-home comment is that, even though there are so many different approaches, in the end, I feel I still have learned a lot in the different CPD that I had been. However, I had never just took on the one belief, even if I attended a course that is very, very strong in one way. Or one set of belief. I always would go back to my fundamental and apply my own critical thinking. And I think Prof. Kleinberg also had seen that in terms of when I reflect what I had learned from those courses. And I'm very grateful of the DClinDent process, because even though perhaps by nature I had always been quite a critical thinker, but not a critical person. But that process just extended myself that bit more to be able to not have too biased a view. We all will have our internal biases. We all will have. But to be able to actually try to seek the answers and the evidence for the different views, to have a little bit more balanced conclusion or perspective. I think that's really important. Often you would go to listen to different CPDs, and I'm quite sure you all agree that even when the presenter provide an evidence-based approach, the evidence they give, of course, will back up what they say. Right. But I think I value more in those who would also give the evidence of the others and be able to rationalize why they have then drawn the expert opinion to what it may be. So yeah.
It's always important to fact check, hey? This is basically what your main point is.
I think. Yeah, because I come prepared, Lawrence. Your your questions in all the previous CPD, I think a very valuable one is often you would ask, what's your favorite CPD, or what CPD you walk away from that you find just useless. I think I just really, I'm not waiting for you to ask me. You see, I just really want to get the message out there. To recent graduates in particular, that you are a very selected cohort where you're very smart already to have been where you are and have completed dentistry. But I do believe how you could further extend yourself is that you should always go into a CPD or any situation in life and think of yourself like a sponge, that you are able to pick up whatever information and apply your own critical filter to then apply in the style that suits you, because we're all different in ability, we're all different in character, and actually how you apply it is the most useful. If you walk into it with a lot of skepticism and pretty much like a cement. And especially if you're very stuck in one way and that's it. And you know, then I find that no matter how great the delivery of a CPD or how much people try to deliver, then you just won't be able to apply. That I think there are always situations where you would learn from. I still learn a lot, even if I convene CPDs, gather different speakers. And, you know, even thinking back to the time where I ran extended fixed pros year by year, you would think it's like, you know, a very similar program. And yet each year I would say that I'll still take a lot of learning from it, whether it's content or it's in organization or it's in dealing with people, communications. So, so yeah, I think keep an open mind and be critical on content, but not towards people. Yeah.
Fair enough. Fair enough. So I guess, yeah, for many recent graduates, I mean, feel like they are expected to be, you know, more competent in prosthodontics than, you know, dental implants very quickly, especially in this given competitive Sydney dental market. You know, what would you say to them? How would they best approach that kind of journey?
I think be very mindful. It's almost like you know, have you heard of in children with delayed gratification? I know that it is
No kids
so
yet.
temptious to just want to be all and do all, but unfortunately, I have to. I don't know if this is a motherly term, but I mean it in it with all due respect, and I know that many of you are so skillful in many ways, but I think that they're pay attention to, in particular, when the people say, I've got a secret to share with you, or there are shortcuts, or, you know, because to me, especially when you're just learning something, it is so important to get the foundation right and to actually execute all the little steps that you're taught. And I think that fundamentally, especially in dental school, there is a reason why you are taught in that structure and in that way. And I think it is very important to that developmental journey. And you may find that, and I certainly have, as I develop my skill, even come up with my own shortcuts, right? But I have come about to do certain things in a faster way because I have actually been through that journey and have come to know how I do things, what I do, and therefore cut certain steps. But you have never really seen me go out there to teach students, look, do it this way because it'll be faster. Because as I now have taught or worked with, I'd like to even see my undergraduate students as my future peers. So let's not say taught, like, you know, share my journey with many people. Some are very visual, some are very audio, some are very high intellect, but it takes some time to connect to the actual application. And there is no one more superior way than another. We are just different. So I do believe, however, is that before you can run, you got to learn to walk and walk well. Otherwise, even if you buy the nicest pair of Nikes, you know, you can put them on, but unless you actually have learned to walk, then, you know, you may not be able to utilize the most fancy tools. So yeah. Does that make sense? I don't know.
Yeah, that makes sense. I mean, I think now we're approaching the dental students. I mean, we just had them on yesterday, you know, a third year and final year dental student. And they were just talking about, you know, they're 1 week into their stricter lockdown measures now. No, would you say there's anything that you would say to them during this time to be spending at home whilst they're, trying to absorb what you've just mentioned?
I think do not feel that you're losing the race at all, because in the end, it is your very own personal journey. And just utilize this time to really hammer onto the fundamental in terms of the theory. Even if you focus on the theory, depending on how deep you go, it can take up a lot of your time, right? And I would still while it's okay, and go for it. Watch, there are so many different online videos that you can find now on procedures, but go back to how you've been taught, and you can mentally rehearse and understand how things are done. You can remember so particular shortcuts in your mind, but I would say before you attempt that shortcut, let's do what you can do step by step well. I'm not rejecting any of the other methods at all, but as you are embarking on doing this beginning process, because this is the time now that you should be doing it slowly, step by step, should you want to maximize it, so that one day as you go into practice, you soon realize that out of that learning environment, there are other things to weigh up on that may not allow you that same comfort zone to do things step by step. And whilst you may feel you are losing certain clinical time, I used to be a gymnast, and I remember before my routine, or I have a major competition, you sit there and you do a mental walkthrough of your routine. So I don't have an apparatus at home that I could just do flip on the beam or whatever. But certainly, just because you're out of the clinic environment right now, as you go through all your theory, and even if you walk through the procedure, I would do step by step in my mind, and rehearse that, so then when you do go into the clinic again, you do not lose touch. So I do encourage those students to allocate a decent amount of time, because this is the time now to go hard on the theory. Abide by, of course, the fundamental in the curriculum, but you can extend certain clinical questions yourself to try and find the evidence, especially if you're curious about something. Start applying your postgrad mentality. So outline the question, find the evidence, screen that yourself. Extra time, bonus mark, do that. Allocate certain time as well daily to do this mental walkthrough of the clinical procedure. Picture yourself in the clinical setting. What are the different instruments you will have set out, so that you don't have to keep asking your DA or go back to issue point to get. Be familiar with all your equipment setup, and walk through again, like how you would numb the patient, or put on the procedure. You can do all this mental preparation. And if watching videos help, then great. But as I say, don't expect to apply different techniques in the uni setting, where you may then feel, well, why can't I do that here? Because of many different reasons, you may not be supported to do different techniques. But one fundamental comment is that it may just feel as though, well, unless as educators we know that you understand what you're doing, and being able to actually tick all the steps well that you do, the basics, we don't already have enough clinical time to check through all this. So how can we support you in different ways to try a variety of things? So there are many different reasons why I feel, and having been an educator myself, to give you that little bit of advice there in such a way. But yeah, so then when you're back in the clinic, you're pumped. Last lockdown, I remember Ben was really good. It's not just an adaptive thing for students, even in private practice. When we were shut down and we didn't have patients, the clinic was very good to still support and employ all the staff. And, there was a process of still even without patient, getting the staff to set up the surgical and pack up, and so that they do not forget how to do setup and pack up. So, a lot of those worries that you have now as a professional person and as an adult, identify the challenge and actually think and apply strategies to keep yourself prepared and keep yourself ready for action. But if you do none of that and just go, it is all challenging, well, we will all empathize. In the end, then that makes a difference between someone who just have a complaint versus someone who have a challenge, but they have actually demonstrated the thinking ability to actually try and mitigate it and try to organize themselves to overcome that challenge, if that makes sense.
Yeah, that definitely makes sense. It reminds me of a time when I was back at uni, when one of the colleagues also said to me, just try to visualize what you're doing, try to memorize it and how it feels and what you're going to do. And on top of that, and it might translate to real life as well. When you're planning for difficult cases earlier on, you want to have it all written out somewhere, so that when you go into clinic, you're not flustered as well. And then you can always refer back to it. So and follow that kind of process. I mean, I don't know if it still happens now, but for the students, but yeah, that was definitely something when you were talking about that, that's what it reminded me of.
But in the end, I think each individual have to take it to their own context. I don't feel that this is absolutely the only way. I do know that, for me, it worked very well back then in tooth cons, where you have to write out all the steps. You have to draw your cavity prep in buccal view, side view, occlusal view. And to some, it's very annoying, right? Like, why do I have to draw it out with my hands when maybe they have a lot of clarity in their mind? And this brings me back to sometimes there's two layers from the educator's point of view. We just really looking for way to ensure that you have a good understanding, but having through that journey, and I appreciate actually people learn in different way and they deliver in different ways. I can appreciate that perhaps after what I spoke about today, you feel very disagreeing. For some, they would like, oh yeah, I can close my eyes and really visualize everything and I feel rehearsed. But for some who are maybe not visual, well, do it your own way. I don't know whether you audio record all the steps and play it through your ear every day, but you get the gist. Well, all I mean is find a way that you can rehearse through, whether it's visual or write it, or, that's what I mean by I'm relying on you now to be a sponge. Don't judge me like a cement. Just take this information that I'm trying to say to you and apply it in your own way. So, yeah.
Fair enough. Definitely food for thought for a lot of the students here. Hey, so you've worked with some of the biggest names in the Australian prosthodontic world. Could you tell us what it's like to work alongside such great clinicians and academics in their field?
I am actually very, very lucky, and I'm so humbled by the fact that I went through my pros journey with some very amazing people. Some of them were already amazing at the time, so such as like Max Gasato and Glenn Lidlow. And some of them become more amazing people as well, as we have completed now more than a decade, like, Ben and Ken and Alan and Twan. But, and then when I came out, suddenly I came from someone who didn't even know what great courses to do, and was, on average par going along, to suddenly working for people like Dan Brenner, Anthony Au, and now I'm with Ben. So, of course, I think that declin dent process really changed all my opportunity and all the connections I have with people. They are all fantastic in their own ways. Even though you might think prosthodontist, and I admit to it, in that or anyone who specializes, we become so knowledgeable and in depth in really that small window of discipline. And we just end up knowing a lot about something so little. And but but even in that little window of pros, there are people who are great communicators. There are people who are fantastic educators. There are people who are very good with business. And the only common thing I think they all have, though, is they have very clear goals and vision. And once they can visualize some things, they can map their way out. And they're great leaders, all of them. And all of them are very, very generous with their knowledge, and generous to share. So yeah, I've been very lucky.
So, I mean, we're talking about goals and, setting goals and achieving them. What are your kind of goals for the next 5 years, either clinically or non-clinically?
Yeah. So my children are very young. So I can share with you my immediate goal. After I've shared that I used to be a gymnast, I always thought I was pretty fit. And even after 3 children, I still felt I was pretty fit. And people are just being kind as I piled on my weight. That never said anything until about 2 months ago, back in May, after my COVID vaccine. I blame it on the vaccine now, it's COVID. I started for the first time after practicing 20 years, started to have some spinal neck problem. And it was a big wake-up call. I mean, I've always said it by my lips that, I could weight loss like this. But obviously I didn't act upon it until now. I hope it shows. So I've lost 10 kilos in 7 weeks.
Wow.
And I would like to...
Congratulations.
Thank you. So my immediate goal right now is to maybe lose another 4 and just be really healthy, because I think many of us, we forget, and I don't want you to forget that you are all very special human beings. Do not let dentistry define you. I'm actually very proud that, in my local community, and when I go to my children's school, people just see me as a community member, as a mum. And of course, when they know what I do, it's just a part of me, but it does not define me. And I think that's really, really important. And I think to know that sometimes I love dentistry and I love prosthodontics, and I'm very happy that I'm a prosthodontist and it's able to complement my lifestyle and my standard of living with the family, and etc. And especially through this very hard time, with so many people in the industry suffering. So my other pet favorite is I used to do musicals. So I really have my heart felt for all the performers and people who are in that entertainment industry right now. So tough. So and in that same context, I'm happy to be employed in the public sector, where as you all know, Westmead and another dental hospital at the moment is under very strict closure or limited work. So I don't have too much more information yet. Last year, I got deployed to work with workplace wellness, but I got a lot of gain out of that in terms of learning about growth mindset, how to change habits, which actually helped my patient conversation, how to deal with them, risk management with caries or parafunction, to guide them way to set their own goals. And to learn about culture and organizational development. So a lot of growth there that then, as a sponge, I apply to my workplace and to my family. So this upcoming term, unfortunately, they've put wellness virtually, so they don't need human beings face to face. But so we'll be doing vaccination. So I don't have too much more information, but you have to maintain flexibility in life. And if you maintain that growth happy mindset, and then no matter where you go, you won't be limited. You will always be able to find ways to adapt to change and to be able to have that resilience and adapt through change and make it beautiful for yourself and those around you.
Wow, so many gems. Oh man, I have so many questions I want to ask, but we're approaching that time now. I don't want to keep you for much longer. So, Dr. Agnes Lai, thank you for coming on the show.
Just call me Agnes.
I
I think no. So we're all human beings first, but I'm always open to anyone who would like to connect, and and if they want to talk about things, like, feel free to make that contact. But of course, if I can support you in any way as a prosthodontist, I'm more than happy to do so. But but thank you very much for having me, Lawrence. It's been lovely to speak.
No, it was our pleasure. Tell us where they can find you.
So you can find me via my social media, I suppose. Or if you're a Sydney sider and you need that support, I practice privately at Chatswood at Sydney Prosthodontic Group, and I also practice in the public sector in Westmead's or Restorative Sciences. So those are the dental setting which will be able to help you.
All right. Thank you. I hope you have a good night, and hopefully we won't be in this lockdown for too much longer. Hey.
No, it's all trying times, but hey, together we can get through it.
That's right. That's right. Have a good night.
Good night.